fact, 1 in every 3 to 5 people in India suffer from fatty liver disease.
If you see 100 patients, 20 to 30 patients will have fatty liver.
This has become a major problem across the world.
All my patients feel or think that only alcohol causes liver diseases.
In fact, 25% of the world population has fatty liver disease. Many people come to me in outpatient clinics with ultrasound report showing that there is fatty liver. So mere presence of fatty liver doesn't indicate that a person has a disease in itself. Okay, we have to make sure that fatty liver is really present in the person. We have to do a couple of blood investigations to know why the fatty liver has come.
Earlier times, fatty liver, we did not bother much. We said, okay, it's just fatty liver, you don't have to worry about it. But knowing that it's an epidemic and it is growing in number, at this moment we would like to evaluate the fatty liver and see what is the cause for it and treat it.
So once I see a patient, a person who comes to me with a report of a fatty liver, what I generally do is I will ask a couple of questions to him about his family history, whether the family members have a similar history of fatty liver disease, if someone has a progressed liver disease due to the fatty liver. Number 2 is whether the patient has been consuming alcohol or not. But mind you, this fatty liver disease can also be caused without even drinking a sip of alcohol as well. So fatty liver can also be caused in a couple of viral diseases like hepatitis B infection, hepatitis C infection, and it can also be caused by various medicines. So once this history has been elicited, then we do a couple of blood tests, that is liver function test. If the liver function test is abnormal, that shows that fatty liver has progressed to inflammation, that is called NASH. So we would not want anyone having fatty liver to go into the NASH. That is the crux where we need to identify the person who is having fatty liver and prevent the disease progression from fatty liver to progressing it to NASH. So once we do this blood test, we do what is called as a fibroscan. Fibroscan is nothing but a liver specific scan which tells us whether really there is a fibrosis or there is scarring of the liver, and to know what is the exact amount of fat in the liver. So once we do these two tests, we will be able to assess at what is the stage of the fatty liver disease and if it warrants any aggressive management. Importance of identifying this fatty liver at the earlier stage will always prevent future catastrophes. Catastrophe in the sense progressive liver disease. Patients with fatty liver disease can also have cardiac issues, can also have central nervous system issues. So patients with fatty liver generally are obese and they are at the borderline of getting diabetes. They may be hypertensive. So all this can be assessed when we see the patient for the first time during the assessment of the fatty liver disease. Unfortunately or fortunately for you, there is no one treatment which is effective for the fatty liver disease. The best rampant for fatty liver disease is weight loss. You have to do weight loss. You have to be in hit the gym every day and have a weight loss routine which is set in. Apart from weight loss, the next important thing is the diet. Diet and weight loss go hand in hand to prevent the progression of the fatty liver disease. Even if you reduce your weight by 10%, that is more than enough to stall the progression of the fatty liver disease. According to a few studies, doing minimum of 20 minutes of aerobic and weight training exercise every day goes a long way in preventing the progression of the fatty liver disease and even reversing the scarring which has already been established in the liver. So if you have a fatty liver, please don't be alarmed or disheartened. Please visit one of your nearest hepatologist or gastroenterologist and sit with your doctor and assess what best can be done to prevent the progression of this liver disease.